Patients often present to ENT clinics with sleep disturbance. The symptoms can include insomnia, interrupted sleep of the sleeping partner, poor energy levels, and daytime sleepiness. Sleep is divided into 5 stages. The first 4 are associated with deepening sleep, decreased muscle activity, and slowed breathing and pulse rate. The 5th stage is reached when rapid eye movement occurs. It is also in this stage that patients dream. The 4th stage is the deepest form of sleep during which the patient is the least arousable. It is associated with delta waves on the electroencephalogram. Sleep disorder in its various forms is very common. A third of adults report sleep disorder at some point in their lives. 20 to 40% of adults report sleep disorder at some time in the year, and 17% rate their sleep disorder as serious. 20% of adults complain of chronic insomnia. Sleep disorder is more common in women, with a female-male ratio of 3 to 2. Men are more likely to have obstructive sleep apnea. 4% of men have obstructive sleep apnea compared with 2.5% in women. Sleep disturbance gets worse with age. In the 30 to 50-year-old group, 5% suffer. Over 50 years of age, this rises to 30%. The elderly experience decreased sleeping periods, awake more often in the night, and are more likely to take medications which disrupt sleep. The causes of sleep disturbance can be split into medical, psychological, and environmental. Medical problems are myriad and include heart failure, neurological conditions, thyroid problems and other disorders of the hormone system, acid reflux from the stomach, stimulants such as caffeine and alcohol, certain medications, and upper airway obstruction. Psychological problems include depression, post-traumatic stress, anxiety, thought disorder, and psychiatric medication. The environmental problems include life-threatening events, shift working, jet lag, changes in altitude, hot sleeping environments, environmental noise, or frequent external disturbance. The treatment for sleep disorder is also complicated and varied given the number of serious medical conditions that can cause it. Patients with sleep disturbance should always consult their primary care doctor. Simple lifestyle changes may also help. Dietary modifications are not generally required, but avoiding big meals and spicy foods 3 hours before bedtime helps. Stimulants and substances that disturb sleep architecture should be avoided. These include caffeine, alcohol, and nicotine. Nicotine and caffeine should be avoided from the late afternoon onwards. Strenuous exercise is good during the day, but should be avoided in the 3 hours before sleep. Psychologically stimulating activities should also be avoided, and these include tense films, engrossing novels, and thrilling TV. Arguments particularly should be avoided before going to bed.